Your outlook changes a lot when you face something like this. I was searching for answers. I knew that I was not getting the treatment that I needed due to my complex medical situation. I was devastated because I'd come so far, I'd experienced so much. I just felt like there was more out there for me.
When I first met Christina, what I thought was unique about her case, I met her at a very trying moment in her life. She was at the time experiencing significant complications from her cancer immunotherapy. She had a very rare neurological complication with inflammation of her brain called meningoencephalitis. She had significant neurological symptoms, had significant neurological impairment, and was basically unable to carry on with her life. She was unable to take care of her daughter.
After additional investigations based on the spinal fluid testing, based on the results of MRI studies, we were able to determine the exact cause of the brain inflammation. It was important to see her quickly so we can determine what type of treatment is best.
I mean, as a mom, I was terrified. I had stage 4 cancer, and I didn't know if I was going to survive that, and I wanted to be there for my daughter more than anything.
Patients with really complex clinical courses, with complex cancers, with rare diseases, really need a team of experts. I believe if we were not to intervene right away, she could have taken a turn for the worse very quickly.
Dr. Lopez and Dr. Dronka reviewed my case and immediately came up with a strategy. Dr. Dronka's proposal was, I think that this tumor can be surgically removed. And this was something I had never heard before. It was leading up to Christmas. I had my surgery. It gave me the opportunity to be officially in remission of stage 4 melanoma. Unbelievable. It's unbelievable.
A big advantage that we have at Mayo Clinic is that we have one of the few autoimmune neurology subspecialty clinics in the nation. And additionally, we have the advantage of working closely with other experts in the field and closely working with our oncology colleagues, with our surgery colleagues. That allows us to really provide that comprehensive multidisciplinary care that patients benefit so much.
There are so many patients with rare cancers that do not have any standard treatment options available. So what we are trying to do is continue to innovate and continue to develop these new treatments.
It gives me hope that there is new treatments and new opportunities on the horizon, and that could mean, years of my life. That's what that means to me. That means I can see a long-term future where I know that Mayo has a plan or a strategy on the horizons that can treat my cancer if it ever recurs, and that is the exciting thing to say.